Today I'm going to be doing a chest assessment on my patient, which is going to be my sister today. So before we enter the patient's room, we're going to check for the vital signs, so the heart rate, the respiratory rate, make sure that that's all normal. If not, then we'll note any abnormalities before going in so we can look for those during our assessment. We'll look at the medical history, if she has any underlying diseases or anything going on before going into the hospital. We'll also look for any allergies and most importantly, why she's in the hospital today. So the doctor's order.
Emphysema with left-sided pneumothorax, long-term smoker, and chest pain.
So she's experiencing chest pain. She's a long-term smoker. She also has the history of emphysema, so that's going to play a part in the chest exam as well. And then she has a possibility of the flu, so that's also going to show within the exam as well. So before we go into the room after doing the doctor's orders, we'll do our hand hygiene. So we'll wash our hands between 15 to 20 seconds. And then she does have the droplet precautions. So we'll don on a mask, gown, and gloves. We'll put the mask on first, and then the gown, and then the gloves last. And then we'll gather our equipment. So I have my stethoscope here. We'll need a pulse ox and blood pressure cuff if she doesn't have the vital signs already done, but those ones are done, and I'm guessing it seems to be normal. It wasn't listed. So then we'll enter the room. Hi, my name is April. I'm a respiratory student. Is it okay if I perform a chest assessment on you today?
Yes.
What's your name and date of birth?
Elise Carter, 5/12 of 2004.
Perfect. Do you mind if I check your bracelet to check your MRN? Looks good. And then we'll visually examine her if she has any cyanosis, pursed-lipped breathing, if she's having any other difficulties breathing that's shown within her body language, any clubbed nails, bruises, scars, also her spinal curvature, if she has any scoliosis, if it seems to be normal. And then we'll also check if she has any chest tubes or wires on her as well, because we'll want to work around those. It doesn't look like she has anything going on, so she should be all set to go. So the first thing that we'll do is we'll raise the bed to about waist height so that it's safer for the patient and for me. And then make sure that the bed rail is down so that we're not working over that. And then we'll start with the tracheal deviation. So I'll place my middle finger in her notch here, and I'll take my two other fingers and run it down, see if it all feels normal. And then I'll have you inhale and exhale deeply. Perfect. That seems to be fine. And then we'll go ahead and do the chest percussions. So we'll take our middle finger here and look for the notches and tap with our other hand, working side to side. And then we'll do the same on the back side as well. So for the chest percussions, since she has a history of the COPD, we might hear a little bit of the hyperresonance. So we'll have to make note of that at the end when we chart as well. And then we'll go ahead and do the tactile phrenitis. So that's going to be listening to the vibrations. So I'll do the front side. You're fine. I'll have you say 99.
99.
Again.
99.
Go ahead.
99.
Perfect. And then I'll do the back side as well.
99. 99. 99. 99.
Perfect. And then next I will go ahead and do her chest expansion. So it's going to be listening to or feeling for her inhale and exhale. It wants to be about 3 to 5 centimeters with those. So I'll have you inhale and exhale. Perfect. And then lastly, we'll do her oscillation. So I'll listen to her breathing with the stethoscope. So we'll start on the front side here. Just breathe normal. under your arm, under your other arm, and then we'll do the same on the back side, working our way down. Perfect. And then for the osculation, since she has the history of the emphysema, we may hear the coarse crackles within that as well for her breathing. So then I'll have you lay back down, and then I will lower the bed back down to its lowest height, adjust the bed rails, make sure that her restraints are good and tight if she is restrained. She's not restrained today, but if she was, we would double check that, make sure that it's secure to the bed. And then we will also take the call light, place it on her bedside table so that it's within reach for her. If she does need the nurse, she can go ahead and call the nurse as well. And then once leaving the room, we will take off our PPE. So for that, we'll take off gown, gloves, mask. And then once we leave the room, we'll also sanitize or hand wash again. Just because of the precautions and going in and out of patients' room, you want to make sure that you do that every time. And then after that, we will chart any findings that we found. So we'll note the hyperresonance, the coarse crackles. If there was anything else that we noticed with her, we would chart it as well. And yeah, so we'll just chart all of our findings once we leave the room.